Susan Monarez, the former director of the Centers for Disease Control and Prevention, CDC. Dr. Monarez was the first Senate-confirmed CDC director. She was previously the deputy director of the Advanced Research Projects Agency for Health, ARPA-H, where she helped oversee a $2 billion portfolio to advance healthcare breakthroughs. Dr. Monarez earned her PhD in microbiology and immunology from the University of Wisconsin-Madison and completed her postdoctoral fellowship in microbiology and immunology at Stanford University School of Medicine. Dr. Oury, we're also joined by the former Chief Medical Officer and Deputy Director for Program and Science at the Centers for Disease Control. Dr. Oury oversaw CDC's 9 national centers and the agency's Office of Science with a combined budget over $6 billion. She also previously led CDC's National Center for Injury Prevention and Control, where she helped lead CDC's work responding to the opioid crisis. Dr. Oury is a graduate of Emory University and received her MD and MPH degrees from Tulane University. She completed her residency training in emergency medicine at Denver Health Medical Center. I shall now begin. Oh, the opening statements, 101 again. Please, Dr. Monarez. Is your microphone on?
Is this on? I believe it's on. Can you hear me?
Yeah.
Close to the mic.
Thank you. Chairman Cassidy, Ranking Member Sanders, and distinguished members of this committee. Thank you for the opportunity to testify before you again. My name is Susan Monarez, and I am a microbiologist and immunologist. Exactly 12 weeks ago, in this same room, I testified that if confirmed, I would lead the CDC to restore public trust, modernize public health infrastructure, and strengthen the agency's core mission of protecting Americans from infectious diseases and emerging threats. I was honored to be nominated by President Trump and confirmed with the Senate's support. Secretary Kennedy himself swore me in on July 31st, calling me a public health expert with unimpeachable scientific credentials. My tenure as CDC director lasted 29 days. Since my removal, several explanations have been offered: that I told the secretary I would resign, that I was not aligned with the administration priorities, or that I was untrustworthy. None of those reflect what actually happened. I will share the details, but I want to be clear. Today should not be about me. Today should be about the future of trust in public health. The events leading to my dismissal began weeks before August 25th. On August 2nd, I learned from media reports that experts serving as liaison representatives to the Advisory Committee on Immunization Practices, the ACIP, including those from major medical societies, had been removed from its working groups. The following week, I heard concerns that the ACIP might alter childhood vaccine schedule at its September meeting, potentially without credible supporting data. On August 8th, a gunman, driven by vaccine distrust, fired 180 rounds into CDC headquarters in Atlanta, killing Officer David Rose. In the days after the attack, I focused on security, staff, and ensuring the CDC could continue its mission. On August 19th, I received a directive from the Secretary's office that I now required prior approval from my political staff for CDC policy and personnel decisions. On August 21st, I was told to return to Washington from Atlanta immediately. To do. When I did return, I was public official. He directed me to commit in advance to approving every ACIP recommendation, regardless of the scientific evidence. Me to dismiss career officials responsible for vaccine policy without cause. He said if I was unwilling to do both, I should resign. The evidence, and I had no basis to fire scientific experts. He told me he had already for 3 decades. Always challenging the status quo and welcoming the change. Even under pressure, I could not replace evidence.
Dr. Monarez, you're almost out of time. I'll be generous, but if you could speed up just a little.
Predetermined outcomes. As I wrote in my September 4th Wall Street, ask for proof about our vaccines, and I also agree with his most recent demanding evidence is exactly what I was doing when I insisted CDC misaligned with the administration priorities, the goals Secretary Kennedy structure, modernizing systems, investing in the workforce, and enhancing hearing, and began advancing during my short tenure. Achieved without the expertise required at CDC. Kennedy, I made commitments to this committee that I would lead with maximize health outcomes and protect the American people. Secretary commit to approving vaccine recommendations without evidence, fire career. My concerns with this committee. I told the secretary I was told I still had my job, but the secretary's expectations remain for scientists. I would not commit to that, and I believe it is the truth. Based on what I observed during my tenure, there is a real risk that others in need without rigorous scientific review. The stakes are not theoretical. We already have seen 2 children. If vaccine protections are weakened, preventable scientific integrity, but that line does not disappear with me. It now counseling a patient and every American who demands accountability. I spoke then about the value of hard work, paying my health. On August 25th, no one would have known. What the public would have seen were scientists all under the authority of a Senate-confirmed director with unimpeded title, but I would have lost the one thing that cannot be replaced or mischaracterize my words. That is part of public life, but I'm a public servant and a parent committed to protecting the health of future generations. We will keep faith with our children and grandchildren, ensuring they polio, measles, diphtheria, whooping cough, and many others.
Thank you. Dr. Ory?
Chairman Cassidy, for the opportunity to testify before you today. Resigned from CDC. I come to you as a doctor. I worked as an emergency physician, treating patients where I saw firsthand even more devastating when it's preventable. That's individual patients to protecting the nation. Poor administrations. In each case, priorities that has changed. I resigned because CDC based in science and putting American lives at risk. Its processes and stripped leaders of independence. America's progress in health is one of the great expectancy hovered around 39 years. Today, it is through safer food and water, through smoking cessation, and through the county across the country. There is certainly still work to be done. Institutions and processes that deliver evidence-based intervention. Secretary Kennedy is doing. We trade proven gains for yet all 17 voting members of ACIP critics. Flu campaigns were halted. The highest non-pandemic total ever, with 90%. We also saw the highest number of measles cases in 30 years. Vaccines, the Secretary spread misinformation, and these labs and data systems are our nation's first line of defense against under the Secretary, global flu 70%, leaving us with far less visibility into what's on birth effects and chronic disease out of CDC will fragment, and more recently with Oropouche, that reproductive health expertise due to the Secretary's actions, our declines in health. Trust and transparency. Our CDC COVID vaccine guidance on an ex-social not seeing the scientific data or justification for this change. The Secretary's office ordered the removal from our website of the CDC scientific science has shown is not linked to autism, while allowing containing scientific assertions that were not assessed for data quality undermines confidence in the deliberations that follow and is certain. While at CDC, I worked with thousands of the hardest working, dedicated people for healthier lives. My goal today is to provide real constructive steps squarely within Congress's responsibilities. I look forward to
Yes, officials come, I'll be equally generous with them. And by the way, of the minority, and the minority did not agree to that. So
He came before us, he was not sworn in, to the best of my knowledge.
consent, it's certainly the right of the minority to object to that, and he did.
I would ask unanimous consent that be sworn in.
You know,
I object to the request to waive our committee rules. He appeared before this committee on 2 occasions and moment seems to discuss that for future hearings and maybe go along with that, but not right now.
okay.
When he swore me in, he was in the room, he swore me in. He chatted briefly.
And then you met the 25th as well.
Distinct meetings that day.
Okay. And what did he tell you to do?
Firing scientists or resign. Regardless of whether or not there was scientific evidence.
And what were those recommendations? Did you have? Okay.
And if I could not commit to a he told me he had already spoken to the White House about having me removed. That very day, in that morning meeting, he said that the childhood vaccine in that morning meeting, he did say that he had spoken
Did Secretary Kennedy ask you to speak to anybody outside of HHS?
or collaborators, I don't know what the relationship is, was coming into
Aaron Siri, is he the trial attorney who
or science to point to. As a matter of fact, we got into an exchange where I had suggested that I would be open to changing childhood vaccine schedules if the evidence or science were supportive. And he responded that there was no science or evidence associated with the childhood vaccine schedule. And he elaborated that CDC had never collected the science or the data to make it available related to the safety and efficacy.
To be clear, he said there was not science or data, but that you still expected you to change the schedule.
Correct.
Okay. Dr. Oury, Dr. Monarez has just said the secretary directed her to accept vaccine recommendations without seeing them and for which there is no science. Related to tomorrow's ACIP meeting, who decided what would be on the agenda?
So I don't have great visibility into that. I know the senior advisor and HHS counselor worked with our staff and the designated federal official and proposed items.
Okay, and who is the senior counselor?
The senior advisor is Stuart Burns, and the HHS counselor is Ren Archer.
And those are political appointees answerable to the secretary?
Yes.
Is that the way does normally the cabinet secretary or political staff set the agenda for a scientific meeting?
Not for the past decade. I was at CDC.
So this is the first time that's been the case?
Yes.
And in preparing materials for the meeting, were you told to disregard science or to enhance science, or what were you supposed to do?
For the last meeting, we had developed.
I'm talking about this meeting coming up.
So for this meeting, we didn't have work groups other than one for COVID. So CDC scientists were being asked by ACIP to develop questions and recommendations. I did suggest additional questions that the hepatitis B work group look at so that they could look at differences in age groups. The senior advisor was concerned that could bias moving away from a birth dose. I asked how asking questions and providing data could do bias if we didn't have the answers yet.
Biased against moving away from, you're suggesting that they wanted to move away from the birth dose, but they were afraid that your data would say that they should retain it?
Correct.
That's okay. Senator Sanders.
Thank you, Mr. Chairman. Dr. Monarez, at a September 4th hearing in the Finance Committee, Secretary Kennedy called you a liar for stating that you were fired because you refused to pre-approve vaccine recommendations. Is that accurate? Are you a liar?
That is not accurate.
Why did you believe it was so important for you to refuse to rubber stamp vaccine recommendations without seeing them or the evidence behind them? What did you fear was the worst case scenario if you had agreed to doing that?
I refuse to do it because I have built a career on scientific integrity. And my worst fear was that I would then be in a position of approving something that would reduce access of life-saving vaccines to children and others who need them.
Okay. Dr. Monarez, the American Medical Association, the largest physician group in America, 270,000 physicians. The American Academy of Pediatrics, over 67,000 pediatricians. The American Academy of Family Physicians, representing over 125,000 doctors. The American Osteopathic Association, representing over 200,000 doctors. And the American College of Physicians, representing over 160,000 doctors. They believe that vaccines are safe and effective. Do you agree with them?
I do.
And what is your concern? What are the long-term implications for the well-being of our kids and the future of our country if faith in vaccine science is undermined?
I believe preventable diseases will return. And I believe that we will have our children harmed for things that we know they do not need to be harmed by. Polio, measles, diphtheria, whooping cough. I worry about the ramifications for those children in illness and in death. I worry about our school systems. I worry about our medical institutions having to take care of sick kids that could have been prevented by effective and safe vaccines. I worry about the future of trust in public health.
Would you agree with me in suggesting that the overwhelming body of scientific and medical thought believes that vaccines have been a major public health advance for the people of this world.
I absolutely agree with that.
Okay. Dr. Howery, during your testimony, you talked about fears for the future. Several years ago, as everybody in this country knows, we went through a terrible pandemic, worldwide pandemic. We lost over 1 million people. What are if trust in vaccines is diminished, if moms do not take their kids in to get vaccines, older people don't get vaccines, what will that mean in terms of our ability to save lives if, God forbid, another pandemic takes place?
So we're already beginning to see that as we're seeing childhood vaccination rates decrease. For example, measles is down to about 92.8%. That leaves over 200,000 kids now at risk for measles. So we are at risk for measles outbreaks. And for the next type of pandemic, a novel pathogen, with some of the staff cuts we have faced, we have less ready responders, we have less visibility into global pathogens at this time as well.
What would have happened to our country, and in fact the world, if, and I don't agree with President Trump very often, God knows, but if we had not developed warp speed and developed that COVID vaccine, did that, in your view, save millions of lives?
Operation Warp Speed absolutely saved millions of lives and was such a godsend for our country.
And if we don't have the capability to do that in the future, the implications will be?
We won't be able to have vaccines to save lives and protect people. We won't have that technology development. We won't have that platform, and we won't have people willing to accept vaccines.
And that will impact not only our country, but people throughout the entire world.
Absolutely.
Okay. Thank you, Mr. Chairman.
Senator Paul.
Dr. Monarez, I agree with you completely that we need to restore trust in public health. But in order to do so, we have to have a discussion about the actual science, and we can't have a discussion this, is about all vaccines are good, all vaccines are bad. This is about specific vaccines, it's about specific age groups, and it's about specific policies. Does the COVID vaccine prevent transmission?
The COVID vaccine can reduce viral load in individuals who are
Does it prevent transmission?
When you have reduced viral load, you will have reduced transmission.
But in other words, it doesn't prevent transmission. You can still transmit the virus if you've had the vaccine. In fact, there's been reduced ability to interfere with transmission over time. And what we've found is the most recent one since Omicron is down around 16% reduction, if there is a reduction. Does the COVID vaccine reduce hospitalization for children under 18?
It can.
It doesn't. The statistics are inconclusive, and the reason you can't prove that it does is there's so few people under 18 that go to the hospital. The numbers are extraordinarily small. There's like 76 million kids under 18 in our country. 183 died, and a few thousand went to the hospital in 2020 and 2021. And since then, the numbers have dropped precipitously, and the idea and the issue needs to be discussed. But the COVID vaccine is not reducing hospitalization. It's not statistically significant. Does the COVID vaccine reduce the rate of death for children under 18?
It can.
Once again, it can. That's a ridiculous answer. No, it doesn't, and there is no statistical evidence that it does reduce the death rate. These are statistics. We've looked at it. When they approved it, they had this discussion at the vaccine committee that we've been talking about. During the discussion, they acknowledged that there was no proof of reduction in hospitalization or in death. So what they did is they said, what can we use to try to make people take this vaccine? They came up with this. They said that if we give you a COVID vaccine, you make antibodies. So really the whole recommendation for having a COVID vaccine from 6 months up is not based on hospitalization data, not based on deaths. It's based on whether you make antibodies or not. And what people fail to see from this is I can inject you with a foreign protein every week and measure your antibodies. You'll make antibodies every time. It just means immunology work has nothing to do with whether you should get a vaccine every week. So when we're discussing the science here, we have to discuss what is the science in favor of giving a vaccine to a 6-month-old and what are the benefits from that. And there is no benefit of hospitalization or death. And then what would the risks of the vaccine be? We have large population studies of the risks of the vaccine in younger people. And it turns out that you don't see this as much if you look at the general population, but once you start isolating in by age group, which you have to do in COVID because there's such a disparity among age group, you find that there is a risk of myocarditis, a significant event. It's somewhere between 6 and 8 in 10,000. but that's much greater than the risk of hospitalization or death, which are not even measurable because they're so small. So you resisted firing people who have this idea that the COVID vaccine should be at 6 months. That's what this is about. You didn't resist firing the perfect, beautiful scientists that are career people and unobjective and unbiased. You wouldn't fire the people who are saying that we have to vaccinate our kids at 6 months of age. That's who you refused to fire.
So that assertion is not commensurate with the experience that I had with the individuals who are identified to be fired.
Did any of the people you refused to fire, did any of the people you
Allowed to answer the question?
Did any of the people you refused to fire believe that we should change the vaccine schedule and no longer force 6-month-old kids to take it? Every one of them was adamant we should keep it at 6 months. Everybody's alarmed, we're going to change the childhood routine. Well, we should. There is no medical reason. What is the medical reason to give a hepatitis B vaccine to a newborn whose mom has no hepatitis?
So none of the discussion points that you just brought up were ever.
That's changing the childhood schedule.
Will you allow her to answer the question?
Regular order,
You have
regular
your
order.
time. You have your
Regular
time,
order.
Bernie. I got mine. Look, this is the debate over changing the childhood schedule. The hepatitis B vaccine on the schedule is given to newborns. What is the medical, scientific reason and proof for giving a newborn a hepatitis B vaccine if the mom is Hep B negative?
I want to go back to the assertion associated.
What is the medical reason for giving a hepatitis B vaccine to a newborn? See, everybody's like blithely going along, we can't change the childhood. You're somehow terrible if you want to change the childhood. We should be discussing what is the childhood vaccine schedule, and the burden should be on you. You want to make all the kids take this? The burden is upon you and the people you wouldn't fire to prove to us that we need to give our 6-month-old a COVID vaccine and that we need to give our 1-day-old a hepatitis B vaccine. That's what the debate ought to be about, not whether all vaccines are good or whether we live in Alice in Wonderland.
I actually agree with you, and I was open to the science. I just would not pre-commit to approving all the ACIP recommendations without the science.
Untrue.
Is the witness allowed to answer that question, or do I have to use my time?
She answered the question. Did you have more to say, Dr. Monarez?
The last thing I wanted to say about those scientists, we had never discussed any of their thoughts, considerations. Or
We being we. Who is we?
me and the scientists that I was being asked to dismiss. As far as I know, they had never said that they are pre-committed to maintaining any of the decisions that had been made. All of us had agreed that the science evolves and we need to see the data and the evidence to ensure that we are protecting our children.
Okay. Senator Murray.
Thank you, Mr. Chairman. In May, Secretary Kennedy announced in a video on social media that the COVID vaccine was no longer going to be recommended under CDC guidelines for most children and pregnant women. The fallout was actually immediate. I heard from a nurse in my state who was pregnant. She was trying to get the vaccine. She was turned away by several pharmacies, ended up calling my office and saying, what am I going to do? Dr. Howery, I wanted to ask you, how did you learn about CDC's new COVID vaccination guidance in May?
The same as you on social media.
What was your title at CDC when that happened?
I was the chief medical officer of the agency.
It's unthinkable to me that the chief medical officer at CDC was left in the dark about such a consequential public health decision that affected real people. Dr. Howery, how was this change in guidance supported?
Yes, because I couldn't implement guidance off of a tweet. The written
COVID vaccine recommendations. And as we all know, the ACIP is meeting tomorrow. Data, the CDC director and the medical officer would
be able to evaluate the decisions before them. The processes were regular in terms of using the evidence to recommend. There was working groups that substantiated the information. There was robust deliberation during the ACIP meeting. I would say that it comported to the standards where the Americans could trust them.
Dr. Harris.
Agree. The data was presented and the committee was filled with experts with experience.
The newly chosen ACIP members met in June, and they're going to meet again tomorrow. Will either of you feel confident telling parents they can now trust the ACIP recommendations that come out of this week's meeting?
I'm very nervous about it. I don't know. They haven't met yet. I know that the medical community has raised concerns about whether or not, again, they have the commensurate backgrounds to be able to understand the data and the evidence and to evaluate it appropriately. I haven't prejudged. I don't know what will happen, but I certainly will be watching.
Dr. Harry?
I have significant concerns as the public hasn't been able to weigh in. The general vote should have been posted 2 weeks ago so the public knew what was being discussed other than high-level things. There haven't been work groups other than for COVID, and there haven't been, as of yesterday, the data hadn't been posted yet. So it's unclear to me what decisions are being made.
Thank you. Thank you very much, Mr. Chairman.
Senator Collins.
Thank you, Mr. Chairman. Dr. Monarez, the recent turmoil at the CDC only serves to further undermine public confidence in its recommendations. You've had a very unusual tenure there, to say the least. You started out as acting director and had a good relationship with Secretary Kennedy, such that he recommended your appointment to the president. Then you were confirmed by a unanimous Republican vote, but opposed by every Democrat and every independent in the Senate. Then, less than a month on the job, you were abruptly fired. So I want to discuss with you further the grounds for your firing, even though I recognize the president has that authority. But as many of us have said, we just changed the law to make the CDC director appointed or confirmed by the Senate. And thus we have a duty here. First of all, Secretary Kennedy replaced every single member of the advisory committee. Did he consult with you about any of the replacements?
No.
When you met with him on August 25th, you have testified that he asked you to approve the recommendations of the new members of the committee, regardless of what they were. Is that correct?
That is correct.
So Secretary Kennedy, in testimony before the Finance Committee, has denied asking you to do that. Is there any doubt? Could you describe the discussion that you had on that issue?
Yeah, I'm happy to. The secretary in that morning meeting was very upset, very animated, and he said, with regard to that particular topic, I have heard that you may not sign off on the forthcoming ACIP recommendations. And I said, I cannot sign off on something before I see the data and the evidence. And he said, and elaborated on this for some period of time, that there is no data and evidence, there is no science, that CDC has never collected the data, the evidence, and the science associated with the safety and efficacy of the vaccines, and that I needed to commit to signing off on each and every one of those recommendations, and if I could not commit to that, I needed to resign.
What are the implications for public health if important scientific decisions at the CDC are made by the political staff rather than the career scientists?
It concerns me. It really concerns me. As you are aware, and Dr. Oury can elaborate on, these are very important, highly technical discussions that have life-saving implications for our children and others who need vaccines. And if you don't have the commensurate skill sets or the ability to ask the right questions, and you're willing to sign off on decisions that are not made with the best available data and evidence, it does put at risk our children. It puts at risk others who need these vaccines, and it takes us into a very dangerous place in public health.
Dr. Oury, did HHS's response to the measles outbreak earlier this year differ from its response to other infectious disease outbreaks in your previous interactions with the department?
Yes, in several ways. First, I never briefed the secretary, as did the center director who oversaw measles never briefed the secretary. In an outbreak response, usually you would be briefing leadership. The second thing is he said things like vaccines had fetal parts, and I had to send a note to our leadership team to correct that misinformation. We were also asked to include things like budesonide and clarithromycin in our toolkits for physicians, and I couldn't allow that as there wasn't evidence for that and would result in harm.
Thank you.
Thank you, Mr. Chairman. Dr. Monarez and Dr. Oury, thank you for being here today and being willing to provide this committee with information about what is happening at the Centers for Disease Control and Prevention under Secretary Robert F. Kennedy Jr.'s leadership. Despite his proclamations of radical transparency, Secretary Kennedy has consistently failed to provide information to Congress as he continues to undermine public health from his role in the Trump administration. You've heard from me before, having Secretary Kennedy in charge of the health of Americans is dangerous. And what we're hearing from you today really underscores this for me. Dr. Monarez, when your confirmation was before the Senate, I had my doubts that anyone in your position would be able to stick to the science and stand up to Secretary Kennedy as he compromises the health of the country in order to further his own ideas and agenda. I am pleased to see that you and other senior members of the CDC, like Dr. Oury, did stand up to him when the time came. You've both spoken about censorship and requests to compromise scientific integrity. Dr. Monarez, did Secretary Kennedy ever give you instructions on how you should interact with members of Congress?
He did. After the morning meeting, I became very concerned. I was alarmed that I was not being consistent. I would not be consistent with those areas that I had committed to this committee that I would do: transparency, integrity. And I had reached out to the committee to share my concerns. Secretary Kennedy became aware of that, and he was very concerned that I had spoken to members of Congress, and he told me I was never to do it again.
Congress and the American people need to know what is happening at the CDC, and this censorship is not radical transparency, and it is unacceptable. Dr. Ari, I was shocked to learn that you found out about the changes to the COVID vaccine policy on the social media platform X. Decisions like this must be made in consultation with CDC experts, because otherwise we are left wondering who is advising the Secretary of Health, or if his own conspiracy theories are enough to dictate who can get a vaccine. Dr. Ari, did you ever brief Secretary Kennedy?
I never briefed him. I accompanied him on a tour of CDC after the shooting.
Did your center directors ever directly brief Secretary Kennedy?
They did not.
You were the chief medical officer at the CDC. Would you say that it's harmful to the public if the secretary is not informed by experts like yourself?
Very much so.
How would you characterize Secretary Kennedy's approach to working with scientific experts at the CDC?
You know, we would have loved to have had the conversations with him. I offered to 2 different HHS leaders that we would like to brief the secretary. He never received that, and many times I would send emails to our leadership team to share with HHS when he did say things that weren't scientifically correct so that we could help support him. But again, our requests were not received to brief him.
So tomorrow, ACIP is set to discuss childhood vaccines. And based on what we've seen happening under Secretary Kennedy's leadership, we have to expect it will produce weaker recommendations for these vaccines. And at the same time, there is no Senate-confirmed CDC director in place. Secretary Kennedy has installed someone he is convinced will rubber stamp whatever decisions his anti-vaccine advisory members make as the acting director. In Wisconsin, there are currently 36 cases of measles, all in unvaccinated individuals, 22 of whom are children. I am thankful that we have not seen any deaths yet, as we have in Texas. Dr. Ari, you have seen firsthand in the ER what vaccine-preventable disease can do. What would an increase in vaccine-preventable diseases mean for children and families across the country?
It's going to be heartbreaking. Not only will it overwhelm our healthcare system, but children will have, some of them will be deaf. You know, we've seen congenital measles cases in the U.S., and I think what concerns me is these aren't harmless diseases. We just saw the case in California of a young child that died of encephalitis from years after measles. These diseases have long-term consequences, and we don't need, in the U.S., we have gone so far in reversing this. We don't want our children to die.
We'll go next to Dr. Marshall, and then for the sake of the committee, after that, we'll take a 15-minute break to go vote, and then we will come back and continue. Dr. Marshall.
Dr. Monarez, despite the president's executive order, did you encourage people to work remotely ever?
I did not encourage people to work remotely.
Okay. There were allegations that you took some of the political appointees and you basically took them out of your orbit, out of your office area. Did you reassign office location, desk location for the political appointees?
So I do want to go back to your first question. After the shooting, I allowed staff to work remotely.
Okay, you can give us the details of that later. The second question, did you push political appointees out of your main office area, reassign the political appointees seating?
I brought some political appointees in.
My question is, did you move some out?
So there's a limited number of offices in my
Did you, I guess a yes or no, did you move political appointees out of your main orbit?
And I brought other political appointees in.
Okay, you can give us the details of that later. Do you believe every child over the age of 6 months should have a COVID vaccine at least annually?
I believe that is a discussion that a parent needs to have with their pediatrician. And if it is right for that child, based on the risk, then that child should have the opportunity to get the vaccine.
If there's reports come out that show that indeed the COVID vaccination led to the death of children, would that influence your advice?
Certainly would want to know about that.
Okay, the CDC currently recommends between 70 and 80 shots over the child's lifetime. Do you fully support that recommendation that every child needs every vaccine as recommended by the CDC?
The data associated with those recommendations has been validated and vetted. That is the current schedule.
So you agree that you support every child needs every vaccine that's on the CDC recommendations, all 70 to 80 jabs?
The childhood vaccine schedule has been vetted and validated through science and evidence. The almost 20 different diseases that are mitigated through those vaccines are very important. I think that every parent should have the opportunity to talk to their pediatrician and make sure that they understand the benefits and the risks of those vaccines and what is in the best interest of their children.
Do you believe any or all of those should be mandated?
CDC does not mandate vaccines. What CDC does is provide the evidence associated with the recommendations so that a parent and a physician can make the best determination for them.
When you were considering this job as CDC director, was there ever any doubt in your mind that you could fulfill the mission to work with Secretary Kennedy?
There wasn't. I have worked for political appointees and politicians for almost 20 years. And my experience has been when it comes to critical and important issues like science and medicine, data has always been paramount, and it has always been the core driver to how we work together.
Would you agree with me, though, at this point in time, that you're not the right person for this job, that your belief system, thinking that every child needs every vaccine, which is what your CDC does, every child needs every vaccine, all 70 to 80 of them, is certainly a different mindset than Secretary Kennedy's. And that if the university president, I think a great sports analogy, I hate to do this, but the university president and the athletic director decide you're not the right coach for this team, then it's probably time to say goodbye and we need a new coach. Would you agree that certainly you're going in a different direction philosophically than Secretary Kennedy is?
So I will stand behind scientific integrity with every decision I ever make. If I am put in a position of having to say, I will cede scientific integrity to retain my job, then I am not the right person for the position. I believe that we must have science and evidence to support the best decisions for our children and others who would benefit from vaccines.
So I think here's the biggest difference in philosophy that I see, is that I think the CDC is the cause of vaccine hesitancy, that you are the problem, that because of COVID and you're forcing these vaccines on people that weren't ever really proven or justified, that the benefits didn't outweigh the risk, and you all sat there with your hands in your pockets and you let that happen. And then you let this hepatitis vaccine be at 1 day of age, be forced upon everybody. And all of a sudden, the moms and the grandmas never trust you because you're trying to force a vaccine that's not necessary at day one. If you're going into nursing school, medical school, absolutely, you should consider that hepatitis vaccine. But basically what the CDC does is act like a mandate. And you force doctors that don't agree with you to kick patients out of their clinics because they don't want their child to be exposed to a vaccine that was approved after just like 140 patients took it, being followed up for 5 days. It just makes no sense to me that every person needs every vaccine. But regardless, some of the vaccines have done incredible work. They are a miracle. They've done a great job. The basic vaccines that we got in the 60s and 70s, polio, MMR, DTaP, those seem to be great vaccines that have told the test of time. But your attitude here that every person needs every vaccine is completely contrary to Secretary Kennedy's philosophy and the mission of the president. Thank you.
So, as announced earlier, we will stand in recess subject to the calling of the chair. I expect it'll be about 15 minutes. We ask the members of the audience to stay in your seats so the witnesses can retreat to the holding room. We'll be back.